Today we are going to discuss on a most important topic, so that is hyponatremia. Here, before going to the hyponatremia, we should know what is sodium. Okay, so why it is important to the body cells? Yes, here the sodium is the mineral as well as a nutrient in the body. It plays a very important role in the maintenance of so there is fluid balance, regulation of blood pressure, maintaining the nerve and the muscle functions, as well as the maintaining osmotic pressure. It is very essential. Okay, for that reason it is considered as the most crucial, so that is electrolyte in a body. Here the normal sodium level, it is 135 to 145 millimole per liter and a milliequivalent per liter. Here the sodium is represented as Na. Here now come to so what is hyponatremia? Here hypo means a below or a low. The natremia means the sodium, blood sodium level. It means it is also we call as the low blood sodium level. Here the what happens in hyponatremia, so the imbalance of water and electrolyte, so the mainly it affects the brains. It may causes cerebral edema. Yeah, so what is the definition of, so there is hyponatremia? Hyponatremia is defined as it is an electrolyte disorder in which so there is sodium, blood sodium level becomes false or the below the 135 milli equivalent per liter. It is called as so there is hyponatremia. Now come to the what are the causes? Okay, so what are the causes for hyponatremia? The medications, especially the diuretics, it is also called as so that is water fills. Excessive administration of so that is diuretic, it may causes so that is hyponatremia. Okay, so congestive cardiac failure, the cirrhosis of the liver, the chronic kidney disease, and increased ADS secretions. It may especially so that is syndrome of inappropriate antidiuretic hormones. What happens here? The restriction of so there is fluid takes place. Here the dehydration as well as fluid loss also one most important, so the contributing cause for the hyponatremia. Okay, so what happens? What are the signs and symptoms we are going to see in case of hyponatremia? It is represented as for just the mnemonic, so there is lethargy. Here the L means lethargy, E means edema, the T means tremors, H means headache, A means altered mental status, R means restlessness, so G means giddiness, Y means adding area, so that is a fatigue. Okay, so these are the clinical manifestations we are going to see in case of hyponatremia. Now come to how we are going to diagnose. Here the physical examination of the histolytic is very important, and also the men. Okay, so the monitoring the serum electrolyte is very important. If the serum electrolyte falls below 135 millimole per liter, it is considered as okay, so that is hyponatremia. Now come to how we are going to manage. Okay, so here it is hyponatremia is managed by administration of hypertonic drugs along with treating the underlying, so that is causes. The strict intake and output chart is very important. Here the administration of, so that is the 3% NS is that is the golden standard to, so that is treat hyponatremia. But here in case of, so that is hyponatremia, what happens? Water sipped to the, so that is into the cells, it may cause cerebral edema or so that is swelling. The common, so that is swelling takes place in the brain, it may cause so that is cerebral edema. Here this should not administer too rapidly, so that is 3% NS, because it is considered as a hypertonic solutions. So what happens? Because if you suddenly you are rapidly administering so the 3% NS, so it may causes, so that is osmotic demyelination syndrome. It means it causes, so that is high osmotic pressure in the brain. It may causes, so that is death of a myelin sheath in the, so that is brain. It may causes, so that is ODS, so death of myelin cells present in the, so that is brain. Okay, so confusion, coma, and one death. Okay, so this is regarding the clear-cut information regarding to the hyponatremia. Okay, so the role of nursing officer is very important to roll the, so that is hyponatremia and treat. Okay, so accordingly, don't hurry and don't do too rapid administration of, so that is so 3% NS, because it may causes so the damages to the, so the myelin sheath of the brain, and it may cause further, it may complications, it may lead to, so it is seizures, coma, and even death also. Okay, so this is regarding the hyponatremia.